Mr. Speaker, my question is for the Premier. There are upwards of 1,000 nurse vacancies in Nova Scotia. On top of that, 25% of nurses in the province hope to retire in the next 5 years. Even with increased nursing seats, and even if every nurse graduate accepted a job offer, there would still not be close to enough nurses to fill these gaps. Virtually every person in this province who needs health care at all is impacted by the lack of a coherent plan to replace this workforce. So, Mr. Speaker, the government promised to fix health care, and can the Premier explain how that can happen without enough nurses?
The Honourable Minister of Health and Wellness.
Thank you, Mr. Speaker, and thank the member for the question. We know that it's really important that we grow our own healthcare workers, but to the member opposite's point, that's exactly. We need to look at our labour and immigration strategy. We've been working with our partners in labour skills and immigration. We've been working with our federal counterparts. There are a number of initiatives that are underway in regards to how we bring folks into this province, how we credential them, how we make sure that their education is par with ours so that we can get them on the floors and get them taking care of Nova Scotians. We have a number of different plans that are in the test and try stage, and I am very, very hopeful because immigration absolutely is a huge part of our success to fixing the workforce in Nova Scotia.
The Honourable Leader of the New Democratic Party.
Thank you, Mr. Speaker, and thank you for that answer, although I hope they can also find a place to live. Mr. Speaker, there are roughly 1,000 healthcare vacancies on top of nurses, including dozens of paramedics. The ones we speak to don't have great things to say about the government. In the meantime, people are waiting and waiting in doctors' offices, in emergency rooms, and in their homes for an ambulance. In a global shortage of health professionals, this government keeps repeating, and we just heard, recruitment, 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 but they won't even tell us the employment status of the person in charge of recruitment. So, Mr. Speaker, I'd like to ask the Premier, does he have a real plan to fill these vacancies? And if so, can he share it with Nova Scotians?
The Honourable Minister of Health and Wellness.
Thank you, Mr. Speaker. And we certainly know that stabilizing the workforce in this province is a key to our success. So we have hired 100 medical drivers that are non-paramedics to allow paramedics, as an example, to do the work that they are, the emergency services that they respond. In regards to the paramedicine workforce, we have a workforce that committee that sits on a regular basis that includes the College of Paramedicine, it includes the union, it includes Nova Scotia Health, it includes the Department of Health and Wellness. We have a graduate license to make sure the paramedics can get into the trucks and into the community sooner. We know there's a lot of work to do, Mr. Speaker, but these are early signs that we are committed to improving health care in Nova Scotia.